That means on a Thursday afternoon we take the time to talk to Dr. Ron Ehrlich. Hello, Ron. How are you?
Good, thanks, Brent. How are you?
Good, thank you. That was an interesting discussion with Ennis, a doctor on the Gold Coast, and Troy, his email. There are many people that get in touch with me via email that are taking the same approach to these vaccines as Troy, though, which is a concern because it seems as though those numbers are slightly growing.
Yeah, look, it's a very, very complex and confusing issue because ultimately a vaccine, what it does is it reduces your risk of contracting the complications of or even dying from the virus. And so the ultimate goal of the vaccine is to reduce risk and reduce load on our healthcare system. I'm actually, my guest next week, I hate to do a plug here now, Brent, but my guest on my podcast next week is Dr. Robert Boy, Professor Robert Boy, and he's been on TV and radio many times. And I ask him quite a few questions, and then later in the week I do a thing about pandemics and what I understand about them, but that's a whole other story.
You'll be pleased to know Professor Robert Boy has been a regular on our show here, so we're familiar with him, and he's a lovely man, and he's able to take difficult things and turn it into, I suppose, a layman's way of explaining it all, isn't he?
Yep.
He's fantastic.
Yep.
Today, I've got quite a few listeners' questions. Just one thing before we get into this. The email that I read out from Troy, he says negative labels such as anti-vaxxer does not assist the process. I suppose what we say to people like Troy, and there are lots of other people like Troy, who have had all the other vaccines, they just don't want to have this particular vaccine.
Yep.
No point in getting into an argument with these people, is it?
No.
That's their attitude. No. I don't think we're going to change their mind. So you just say, well, there's a certain percentage of people that aren't going to be vaccinated until, 3 or 4 years down the track.
Yeah. Look, I really do get annoyed when people are labelled right-wingers or anti-vaxxers and all of this. My approach to this whole thing has been to be as inclusive and as collaborative and proactive as possible to find out what is the best for public health. And that can be vaccines as well as improving immune function. And if we're really interested in public health, then this is such a great opportunity, this pandemic. We've got a world population focused on health like never before. And so if they were getting good advice about how to improve their health, they could reduce the risk of comorbidities, which used to be called chronic diseases, which in turn would reduce their risk of contracting the complications of the virus. So, it's a combined thing of everything that's good. Let's put it out there, but let's not label people. Let's be more collaborative.
You've just given me an idea for next week, something that I will do, and I will use Professor Robert Boy to do it. We're going to talk about long COVID. We don't do that enough. We don't talk about the problems with long COVID. I think that might be a sensible thing to do to highlight what are some of the serious illnesses that people will go through and contract and not be able to get rid of, for goodness sake, if with this long COVID thing.
Yeah, no, I think... Robert is a very good person to be talking to.
Okay, let's talk to you, because so are you. We've got some listener questions today. I thought you would like to get some listener questions. Let's start with question number one. This is from Barry. Thank you, Barry. And look, I've also got to say, before we get into the listener questions, if you've got a question you'd like me to put to Dr. Ron Ehrlich, just send it to us. You can go through the 2SM website in Sydney, or you can actually go through the local website here, brett at 2hd.com.au, and I will pass them on to Dr. Ron, and we'll do as we do with Dr. Ross Walker. We'll ask him the question on air. So let's start. Why are we told to brush our teeth for 2 minutes? This is from Barry.
Yeah, that's a good question, because people just look at their mouths as a mouth and they don't think about the detail. There's a lot going on in the mouth. And if you have 28 teeth, we actually have evolved to have 32 teeth, but a lot of people have had their wisdom teeth out. So let's say people have 28 teeth in their mouth. That means on each tooth there are at least 4 or 5 surfaces to clean per tooth. So that adds up to about 120 at least surfaces to clean when you brush and floss. If you don't floss, you're missing out on about 40 or 50 or 60 of those. So it's important to take your time and be thorough, because disrupting the plaque, the bacteria, is the key. And And I like to multitask, Brent, so I use the 2 minutes that I brush in the morning and at night as a mindfulness exercise as well. You know how we talk about mindfulness and meditation?
Mm-hmm.
Well, why not multitask, get two things done at once, and just totally focus on doing a very thorough job for 2 minutes, and that is a great mental exercise, and it's a great exercise for your oral health. So there's a lot going on in there. Take your time, be thorough.
I've recently updated my toothbrush, and I bought one of these electric toothbrushes that has a timer on it. But
Yes.
this has a timer for every 30 seconds. So after 30 seconds, it goes zip, 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 zip. And then after the next 30 seconds, zip, 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 and so on. And when you get to the 2 minutes, it gives you an extended zip, 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 zip.
Yep.
I find that to be really, really good, to be totally
Yes.
honest, because you
Yep.
can think of other things if you like, and the zip zip reminds you, okay, I've finished with the left-hand top of the side of my mouth, I'll now move to the right-hand top side, and that works for me.
Yeah, well, whatever works. And listen, toothbrushing is a habit. So if you miss a spot one day, you will miss it every day. And you may be cleaning 90% of your tooth surface very well, but it's that 10% that you miss each and every day that is where the plaque builds up, where decay creeps in, or where gums become inflamed. So being mindful or using, I think that time is a great idea as well.
Lover or hater, actress Gwyneth Paltrow once said about brushing your teeth. She said, brushing my teeth to me is exactly the same as exercising. I don't enjoy doing it, but I know I have to do it, and I have to do it every day.
Isn't she fabulous?
Okay. If you have a sensitive tooth when you eat something, does it definitely mean that you have a problem with that tooth? And possibly, what's the problem likely to be? That's another Barry.
Yeah, well, Barry, good on you. Look, pain is an indicator that something is not right, okay? Pain is not normal. So if your tooth is sensitive, for example, maybe you've had a filling or a crown done in the last few weeks, months, or even years, a tooth could still be sensitive years after you've had a filling or a crown done, then that probably tells us that the bite on that filling needs to be adjusted. And teeth are so sensitive, they can pick up 10 microns. Now, a hair is 20 microns. So half the thickness of a hair can make a difference, and that difference can make a tooth sensitive. So having that checked is important. So that's one thing. The next question is it sensitive when you are chewing? Is it sensitive to hot or cold? Because there's a big difference there between teeth being sensitive to hot and cold. When teeth are sensitive to cold, it usually tells us that you've been clenching or grinding on the tooth, stirring it up. And that is not a good thing, because our teeth are only meant to touch for about 15 to 30 minutes a day. For the rest of the time, they're meant to just lightly be touching or be slightly apart. So if you clench or grind on your teeth, it's like someone coming up behind you and tapping you on the shoulder for an hour or two. Holding you on the shoulder might be a nice thing to do for a moment, but if they did it for an hour or two, your shoulder would become so sore that you wouldn't want even a cold breeze to touch it. So similarly in the mouth, if the teeth are sensitive to cold, it's usually a reflection of clenching or grinding of teeth. Now, the other one is sensitive to heat, and that is a little more concerning because it tells us that there could be actually something going on within the tooth that could be decay or infection going on there. So there's a lot of different reasons why teeth are sensitive. Does it come on spontaneously? Does it wake you up in the middle of the night? Is it only when you have something hot or cold to drink or eat? Is it only when you're chewing? Does it come and go? You see, some people go, gee, my teeth were sensitive last week, but this week they're not. Well, the reason that happens is because last week you were probably clenching or grinding on your teeth, and this week you're not.
Right.
So that's really important, and it just highlights this really important point, and that is it's so important to get at least a thorough dental exam with x-rays included, because we cannot see through teeth. And as I've said before, Brent, almost 90% of the oral infections, tooth decay, gum disease we see in the mouth have no pain associated with it.
You mentioned crowns then. Can you get, if you've had a crown on a tooth, can you get a hole in that tooth through the crown?
Well, not through the crown, but at some point the crown meets the tooth around the gum line.
Right.
And that is why accuracy is critically important. And when we in dentistry, and this is across the board, talk about accuracy, we consider a gap between crown filling or tooth of about 10 microns to 20 microns would be just about acceptable. So if the fit isn't good, if you don't clean the join between the filling and the tooth, you've still got tooth there, Brent, so your tooth can still decay. The crown itself can't, but underneath the crown can and below the crown can. So, yes, it can still happen.
Do you brush your tongue?
I do, actually. I don't brush it. I use it. I wake up, my routine in the morning is as soon as I wake up, I have a tongue scraper, and I will do 6 little scrapes of my tongue and then have a rinse out. And I also make sure that I hydrate in the morning. That is really important. By my bed, I have an 800 ml water bottle, and that's not so I drink during the night. It's so by the time I have showered, shaved, and got dressed, and gone downstairs for whatever, I will have consumed 800 mils of water as one of the first things I do in the morning. So yes, I scrape my tongue, and I rinse out, and then I have a drink. I actually also do what's called neti, which is a yoga thing of cleaning the nasal passages with warm salt water, which at this day and age probably is not a bad idea. I think it's a pretty good idea. So, boy, we could do a whole program, Brent, on my morning rituals.
I was going to say, let's keep on track here, but let's come back to the neti. That sounds really interesting. So, if you're cleaning your teeth, should you brush your tongue at the same time whilst you're cleaning your teeth?
Yes, I think that's worth doing.
Okay,
that's worth doing, but not with the mouth, not with the toothbrush full of toothpaste. Oh. You know, get all the teeth done. In fact, if we're going to do this, what you should, I think, do is rinse out first. First thing is rinse out. Then brush your teeth, and then with what's left on your brush your tongue as well, and then rinse out. At night, rinse out, floss your teeth, rinse out, brush your teeth, and your tongue again.
One more question here we've got, is taping our mouth to keep it shut of a night good for our mouth and our teeth health?
And if so, why? Well, that's a really good question, because we've talked before, Brent, about how important nasal breathing is for optimal breathing. But actually, mouth breathing is not a good thing for the mouth either, because you dry your mouth out. And saliva has a really important function when we're not eating. It's there to bathe and clean the teeth during the day. So as soon as you have a dry mouth, your oral microbiome, the bacteria in your mouth, starts to change. You lose that cleansing effect of saliva, and you become far more susceptible to tooth decay and gum disease. So there's there are many good reasons for trying mouth tape at night, but and there's all sorts of breathing and body chemistry reasons for that. But right there locally in the mouth, dry lips, that's something we want to avoid if we can. So, yeah, that's why it's important.
There you go, Debbie. Michael says, we've come so far over the years with technology. Why do dentists still scratch, scrape and drill our teeth? Is dental technology changing so this approach will change as well? That's from Michael.
That's a good question. And, gee, I wish I could say, yes, look, it is changing. Dental technology, it's mind-boggling how it has changed in the time that I've been a dentist. And I remember that 30 years ago, they were advertising lasers, which you didn't need to inject, you didn't need to drill, you didn't need to, it was all going to happen without the sound of a drill or injection. And both my brother and I went to the trade fair, and at the time, this was 30 years ago,
yes,
the piece of equipment cost $300,000.
Gosh.
And we put an order in, sight unseen. And we just thought, if something like that exists, we've got to have it. But we said, let's trial it for 2 days in our practice before we purchased. And at the end of the first day, we sent it back because it didn't actually do everything it promised to do. And yes, lasers are being used now, and lasers can do part of the job. But what we're dealing with, Brent, and this is something people, need to remember, is teeth are by far the hardest part of the human body. In fact, when they dig things up that are millions of years old, sometimes all they will find is a tooth and somehow reconstruct a whole body around that tooth. So teeth are so hard that you actually need something really working hard to clean them out and to deal with it. So at this point in time, things are improving all the time, and we are there at the cutting edge trying to be there, but we are still stuck. Now, when you ask about why does a dentist take a sharp probe and probe around your teeth, a lot of people think, is he making a hole in my tooth? You could take that sharp probe and put your entire weight on a healthy tooth, and believe me, you would not make a hole. But if there was a little pinhole through the enamel, which then spreads to the softer dentine underneath, you need a little sharp probe to see whether the probe gets stuck in that. And if it does, sure as eggs, you've got a cavity in that tooth. So, and the calculus that attaches onto people's teeth, the plaque, does that so firmly that sometimes we still do need to use a scraping tool, but we often use what's called ultrasonic cleaning, which is a vibration with water.
Dr. Ron, I've got to go to the news. That's our questions for this week. Again, if you would like to send Dr. Ron Ehrlich some questions, please do so. Go to the 2SM website, or you can send them to our website here, brett@2hd.com.au. And as you've just heard, Dr. Ron answers questions beautifully. Thank you, Ron. Really appreciate it, mate. Good segment.
A pleasure. Thank you, Brent.
We'll talk again next week. That's Dr. Ron Ehrlich.